Good morning, everyone. We're just going to give a few more minutes here to let all the participants log on. Then we'll get started. Okay, great. Just in the interest of time, we'll go ahead and get started here. So good morning, everyone. On behalf of the Georgia Cancer Control Consortium and the HPV Cancer-Free GA Work Group, I'd like to give a warm welcome to our participants and honored guests today for joining us for our 5th annual Cervical Cancer Awareness Day. Due to ongoing COVID-19 precautions, this event is being hosted exclusively in a virtual format for the 2nd year instead of the traditional in-person event that's at the Georgia State Capitol. As a reminder, this event will be recorded and will be uploaded to the internet on the HPV Cancer-Free Georgia website. Some of the feedback we received last year was that the participants wanted continuing education credits for this event, and we are happy to announce that you were heard. We are pleased to offer 1.5 hours of credit for the event today. If you are planning on receiving continuing education credits, please fill out the survey after the event. So before we get into the complete program today, I'd like to start with just a question for our audience. Have you known or do you know someone impacted by cervical cancer? And you can please place your response in the window on your screen once prompted. We'll give a little bit of time for everyone to answer. Perfect. See a lot of responses coming in. Great. We'll go ahead and we got about 70. Yep, there we go. A few more. Go ahead and end it there, and let's see, we'll share the results. So yes, about 66% of participants have known or know somebody who is impacted by cervical cancer, and so a large majority, as we expected. Thanks to all those who responded. As you can see, there is a broad impact of cervical cancer throughout Georgia. Also, a big thank you for taking the time out of your busy schedules today so we can join together and raise awareness about an issue that is important to us all, cervical cancer. Here's a glimpse of the agenda today for you to preview. As you can see, we have planned a full slate of dynamic speakers and experts to speak to you today on addressing a variety of subjects related to cervical cancer and HPV vaccination. So we'll get right to it. My name is Brian Boyce, and I will be your moderator today. I serve as one of the co-chairs of the HPV Cancer-Free GA Work Group, along with Dr. Gabrielle Darville-Sanders. Dr. Darville-Sanders is a professor at Mercer University in the School of Public Health and an expert at leveraging technologies to improve health outcomes in youths and adolescents, with a special interest in health equity among underserved populations. I am a head and neck cancer surgeon at Emory University who treats throat cancers caused by the HPV virus, the same virus that causes most cervical cancers. As we saw through the previous question, many of us have been affected either directly or indirectly by the burden of cervical cancer in Georgia. We are familiar with the physical and psychological scars this disease causes. And despite the amazing advances in treatment and improved survival, the sad truth is that these cancers are almost completely preventable. Through adequate access to healthcare for regular cervical screenings and by vaccination against the HPV virus, most cervical cancers can be eliminated. That is why we are gathered here today, to celebrate our victories and continue the push forward to eliminating cervical cancer. For a little bit of background, this event began 8 years ago because of the efforts and passion of one of our speakers today, Ms. Triana Arnold-James, and through a foundation she established, the Susan Jolly Awareness Program. She was and continues to be the heart and soul of Cervical Cancer Awareness Day, and her inspiration propels us forward today. 5 years ago, the HPV Cancer-Free GA Work Group teamed up with Mrs. Arnold James and the Susan Jolly Awareness Program to form the event as it exists today. So without further ado, I'm very excited to announce our first speaker today, Dr. Jeffrey Hines. Dr. Hines is a physician and expert in the field of gynecology oncology. He is a native of New York and received his medical degree from Brown University. He then completed his OBGYN training at Fitzsimmons Army Medical Center. That was followed by further training in gynecology oncology at Georgetown University in Washington, D.C. He currently practices at WellStar, where he serves as the chief of the Division of Gynecology Oncology and also serves as medical director for diversity, inclusion, and the WellStar Center for Health Equity. He is a well-published researcher and has a special interest in HPV, women's health, and addressing disparities in women's healthcare. Thank you, Dr. Hines, for joining us. It's an honor to have you speak to us today.
Thank you, Dr. Boyce. And good afternoon, everyone. This is certainly an auspicious occasion, and it's wonderful to celebrate the successes that we had and to look forward to the opportunities that are in front of us. Next slide, please. I'll start this presentation with just some data, and I like to put things in the context of where we are in our state of Georgia and how we look with respect to the United States. This is the most up-to-date data as to what's expected in 2022, with just under 15,000 cases of newly diagnosed cervical cancer expected in the United States. 490 of those are expected in the state of Georgia. About 4,300 women will die of disease in the United States. It's expected that 140 women will die due to cervical cancer in the state of Georgia. Now, this is a number. We have to put things in context as to where this disease is. Is it distributed evenly throughout the population or not? Next slide, please. Many people on this webinar are familiar with these two concepts, the concepts of social determinants of health and the drivers of health, because this will really help us get a better understanding as to where cervical cancer exists nationally and where it exists in our state. Overall, the social determinants of health are those circumstances by which we are born, we grow up, we live, we pray, we learn, we work. But importantly, it's shaped by the distribution of money, power, and resources on a global, national, and local level. And these five, as defined by the World Health Organization, social determinants of health include economic stability, the social and community contacts, and that includes things like race, ethnicity, gender, sexual orientation, neighborhood and environment, healthcare or access to healthcare, and education. The drivers of health are similar, but what they reflect is what are those circumstances that really affect disease statuses that people end up with. We know that genetic predisposition makes up about 30% of a particular illness that you may encounter, but other factors include things like social circumstances, environmental exposures, access to healthcare, and behavioral patterns. And these are all influential in cervical cancer. Next slide. As an equity expert, I wouldn't be doing my job if I didn't talk about another important driver of healthcare and disparities that we see in healthcare, including those disparities that we see in cervical cancer, and that's racism. We are all familiar that racism is a significant threat to public health, and it's a significant threat to cervical cancer. And this is the Jeff Hines diagnosis of racism, just so that we can be level-setted. And it is the political power structures, the systems, the laws, the policies that have historically sustained privilege and are embedded throughout society. And it's the fundamental cause and creates the sustained frame of permission that drive health inequities and health disparities. Next slide, please. This is from a paper I published last March that really helps me put together this whole aspect of how health disparities are driven. And we know that slavery comes from the unfortunate, racism comes from the unfortunate history of chattel slavery, and racism is a driver of the social determinants of health. It's a driver of the political determinants of health. It's a driver of implicit biases, microaggressions, prejudices, and these all have a significant impact on health inequities and drive health disparities. The panel to the right side goes over again what those social determinants of health. We can see that the political determinants of health are things like government, policy, and voting. And then the medical determinants of health are those chronic illnesses, and we're going to focus on cervical cancer today. Next slide. So health disparities are clearly defined in our population, and they can manifest themselves in different ways. And the 4 or 5 ways that we typically see them are disparities in the burden of chronic illnesses among different racial and ethnic groups that we might see, or among different demographies, whether you're a rural resident or an urban resident. Disparities exist in the burden of preventable risk factors. There are disparities as to who smokes and who doesn't smoke. There are disparities in screening and early detection, and we'll spend some time in this conference today talking about that. Unfortunately, there are even disparities that exist in the receipt of the standard of care of treatment. And then finally, there are disparities in survivorship, and some of this conversation today will talk about that. Next slide, please. When you put this all together, and this is a slide that I got from the Census Bureau, you can see that those patients who have poverty, unemployment, a certain educational attainment can often co-locate among different racial and ethnic groups. And what this slide demonstrates is those rates of poverty, the rates of higher education, the rates of uninsurance, the rates of unemployment based on race and ethnicity. And you can see that there are certain racial ethnic groups that have a higher incidence of being uninsured or being impoverished or having an unemployment rate compared to others. And unfortunately, you can predict often with chronic illnesses where some of those chronic illnesses are going to be disproportionately seen as well too. Next slide. Now, we know with cervical cancer that more women of color, in particularly Black women and Latinx women, are diagnosed with cervical cancer and unfortunately have a higher risk of death due to cervical cancer. And there's been a lot of work done in Georgia and a lot of work done nationally that looks at why these disparities exist. These disparities exist due to things like poor access to care. These disparities exist due to a lack of what we might call culturally aligned education, education that's in a form that people can understand, and it's in language often as well too. One of the lessons that we've all learned from the coronavirus pandemic with respect to testing and especially with respect to vaccinations is the importance of the message and the importance of the messenger. And certainly from an education perspective about the importance of screening and early detection for cervical cancer, there's much that we can continue to learn from with respect to getting the right messenger with the right message in front of a particular population. Those influencers are people who we can train to be those advocates for patients so that women don't miss out on their screening. One of the interesting facts that we know is, for instance, if you look at Black women often are overrepresented with respect to pap smear screening, but they often get lost to follow-up. So there are some opportunities for us to not only improve some of our screening techniques, but the follow-up is critical. And much of the follow-up will often fall on those social determinants of health? Do patients have the ability to have transportation to get to their follow-up appointments? And these are some things that we just need to be very intentional about if we're going to help get rid of a cancer, as Dr. Boyce said in the beginning, that is truly preventable. So what's that framework and strategy that we can use to achieve excellence within cervical cancer screening, cervical cancer treatment, HPV vaccination through the lens of health equity? Because that's how we should look. We should lead with health equity. We need to bring a variety of partners to the table. We need to bring our insurers, our payers to the table. Healthcare systems need to be brought to the table. Government and agencies of legislature need to be brought to the table. What's the role of entrepreneurs in this space with respect to, say, for instance, are there new platforms that they can help us use to get the word out that's more culturally aligned, or to enable people to get transportation when they need it? What's the role of our community advocacy organizations and our faith-based community, the philanthropic community, and private companies? Next slide. So what then might be a call to action if we're going to look at mitigating cervical cancer disparities? What are the opportunities that we have here locally in Georgia that we might be able to follow? And there's a few that I want you to think about. I think there are some programs and pipelines that we can assure that the healthcare workforce is reflective and appreciates the diverse communities that we serve. We speak in language, we're culturally aligned, we look like the people we serve. This mitigation of cervical cancer disparities is going to require a very comprehensive approach. We're going to lean on science and evidence-based public health policies. We need to provide sustained and robust, predictable funding resources to agencies that are tasked to manage these disparities. We need to continue to acknowledge that systemic racism is a public health problem and impacts cervical cancer disparities. We need to acknowledge that there is the rural-urban disparity that exists. More women in rural communities have cervical cancer and die of cervical cancer compared to women in urban or suburban environments. Similarly, those disparities exist within racial and ethnic groups, and we need to be mindful of that. Next and final slide. We need targeted, culturally aligned in-language education about the importance of Pap testing, HPV testing, and vaccinations, and other speakers in this panel will speak about the importance of vaccination. We need to rely on data and create equity metrics around testing, around screening, around vaccination. We need to embed accountability into all of our organizational structures and verticals. We need to create cross-sector partnerships that are going to address the social determinants of health. And most importantly, just like we're doing today, we need to build trust and collaborative coalitions that are multiracial, multi-ethnic, and ally with our community partners. Next slide. Thank you so much for your time and for so much of what you do in this fight against cervical cancer. Thank you.
Thank you so much for that talk, Dr. Hines, and it was just wonderful to hear that perspective, and thank you for your commitment to improving the health and lives of women across Georgia, and especially advocating how health is more than just waiting to take care of patients once they are sick, but that health and well-being are impacted by a far greater degree by social determinants of health and these systemic factors that you discuss that are often overlooked. It does take getting all these stakeholders to the table. These are not insurmountable challenges, but it does take buy-in from everyone. And thank you for that talk. That was great. Next, it is a privilege to introduce our next speaker and cancer survivor, Miss Cricket Correa. Thank you so much for joining us today, Cricket, and just being willing to share your story.
Thank you so much. Although I am not particularly comfortable speaking publicly, I appreciate the opportunity to speak to you about my victory over cervical cancer. My prayer today is that something in my story will broaden your perspective, whether you work to treat patients, eradicate this disease, or to advance the cause through legislation. My journey with cancer is one of gratitude and hope. Gratitude for the people and the circumstances that contributed to my healing, and hope that this disease will be cured for others. First, I'm grateful for my doctors, my gynecologist, Dr. Stepanian, who 10 years ago was moving into a new office and not yet seeing patients when she agreed to see me the day my primary doctor called her. I went straight upstairs, had my biopsy that very day, and my hysterectomy less than 2 weeks later. I am grateful to my oncologist, Dr. Yap, who removed my lymph nodes and the lining of my bladder based on the tumor board's recommendations for follow-up. My cancer was found early, stage 1, endocervical adenocarcinoma, and no additional treatment was needed. I'm thankful for Northside Hospital and the wonderful care I received through my surgeries and later for lymphedema that lingered after the surgeries. But I'm also grateful for LaTarsha Jones, my assistant principal. At the time of my diagnosis, I had only worked with her for 2 years, having recently moved to Atlanta to be closer to my daughter and my son-in-law when my grandson was born. Prior to my surgery, I had not been feeling well for a few months. And in December of 2011, I had my physical with my primary care doctor, including my PAP, which came back normal. My doctor had prescribed medication for my headaches. And when I had a bad reaction to the medication at work, Miss Jones counseled me to return to the doctor to figure out what was wrong. When I explained to her that I had an appointment in 2 weeks, she would not accept this and handed me the phone. I called the doctor from her office and got an appointment for the next day, and miraculously had my biopsy that very day. I experienced so much relief from that procedure. The pressure in my head drained, along with the fluid that had built up in my uterus, and my tummy returned to its normal shape and size. When I returned home, my daughter was shocked and said I looked beautiful. I told her I felt like I had been to a spa, as I finally had some relief. But to my sister, I confided that the doctor had taken multiple samples and that I was sure that she had found something. I share the story because every one of us has people in our life, people we see every day. One of the things that I've learned from my cancer experience is to be more aware of the people around me. I was not listening to the warning signs my body was giving me. I was blaming it on stress, the loss of my mother, but my boss was, and she had the boldness to encourage me to seek answers. After my diagnosis, I told her 20 years from now, my children will say, LaTarsha Jones saved my mother's life. In February, it will be 10 years since my diagnosis, so I'm halfway there. And I pray every day that I will have her compassion and boldness for those around me. The bottom picture shows my coworkers supporting me as I faced my second surgery. We were sporting yellow at that time because that is my color for hope. And now I've moved into teal. When I received my diagnosis, I was scared, but my first concern was not about my health. It was about my family and my finances. I thought I would return to work and schedule my appointments around work, but Ms. Jones secured a long-term sub for me and told me to focus on my health. I am divorced, and I was grateful my 3 children were grown and doing well, but I did not want to tell them this news. My daughter was returning to work after the birth of my beautiful granddaughter, Maddie, and my youngest son had lost his grandmother along with his wife's grandparents and mother in the 2 years since he had gotten married. I did not want to share this news with them, and I certainly did not want to burden them with my care if it was needed. I was also terribly concerned about finances, from medical expenses and meeting my living expenses if I cannot work for an extended period. I knew I would need guidance and people to talk to outside of my family. I quickly found the cancer support community and made an appointment. Along with my faith, my family, and my friends, this free resource has been an integral part of my cancer healing. Finally, I am grateful I had quality insurance and a job which allowed me to take care of my health. Raising my children, I worked as a waitress. We lived paycheck to paycheck, tiptoeing above the poverty line, and at times receiving food stamps. A social worker had recommended me for a government grant to further my education, which is how I earned my teaching degree when I was 40. I am here today talking about my healing because of both the quality and the expediency of my care. Care I would likely not have received without quality health insurance. Care I would likely not have received if I had been diagnosed when I was raising my children. Which brings me to my hope. I hope your efforts are incredibly successful and we see the end of HPV and the cancers it causes. I hope we will learn to listen more closely to what our bodies are telling us. I hope we will pay more attention to those around us, listen to them and encourage them to seek answers. And I hope that every woman has access to the care she needs so she can tell a story of victory like the story I can tell. Thank you for listening today, and thank you for all you do in the fight against cervical cancer.
Wow. Thank you, Cricket, so much for sharing that powerful testimony and just the many ways that cervical cancer impacts your life and the lives of those around you. And it's not just the concerns of getting the cancer treated. It's how will things come through with finances? How do you talk to loved ones? How do you share this information? And yes, it's a miracle, and it's great in so many ways that you got such prompt and quick treatment that so many people like Dr. Hines don't receive. He mentioned that don't receive across Georgia. So thank you for that. That's extremely powerful, and just thank you for being vulnerable and just walking us through your journey. It's incredible, and we are there with you in your victory, and like you said, just hope that we can do everything we can to eliminate this from Georgia and the United States.
Thank you so much.
Oh, it's really our privilege. It's our privilege. So next, I will hand it off to Dr. Jose Rodriguez, who is a previous HPV champion and current member of our HPV Cancer-Free GA work group. He will be presenting our HPV Champion Awards.
Thank you, Dr. Boyce. Good afternoon. Welcome all. Thank you for being here. Happy to be here. If one thinks of human knowledge, human endeavors, and we find folks who are dedicated, passionate, get things done, are accountable, make common things become magic and things happen, we could call them champions. So I'm very honored and privileged that I received this award once, and I want to acknowledge the recipients of this award for 2022. We have specific criteria, and we have objective outside data to validate these candidates. We have a lot of candidate winners this year. There are two categories, clinic and community. For clinic, the person who made this nomination speaks about the practice has a continually maintain above 80% immunizations despite low staffing and pandemic. From Woodstock, Georgia, I have the privilege to announce WellStart Town Lake Pediatrics as a clinic winner. Congratulations. The next one from Warner Robins. The person who nominated mentioned that this practice has the highest HPV coverage rate in the area. We work locally, that's where we have the most impact. So congratulations to Pavilion Family Medicine Center, Warner Robins, Georgia. The next one in their clinic, it says, these facilities are true immunization champions and never miss an educational opportunity that change behaviors. So out of Leesburg, Georgia, Sumter Pediatrics, Leesburg, Georgia. Those are the four for clinic. Moving on to the community, for 2022, winners of the HPV Champion Award, Cancer Pathways. Cancer Pathways. I'm very proud and honored to read this quote, whoever nominated. It says, this nomination recognizes Jana Mastrogiovanni, Cancer Pathways, for her leadership within the HPV Cancer-Free Georgia work group to successfully plan, coordinate, and execute two Georgia ecosystem-wide HPV awareness events during 2021, including Georgia Cervical Cancer Awareness Day at the Capitol, January of 2021, and the first and annual HPV Awareness Day, March 21st. Jana's ability to collaborate and coordinate with a large and diverse work group constituency play a significant role in the hosting of both highly successful HPV events. For perspective, this is interesting. No other state in the country hosted more than one ecosystem-wide event in 2021. Kudos. On behalf of the entire HPV Cancer-Free Georgia work group, we appreciate Jana's leadership and dedication. Thank you for all you do, Jana. We have two more our winners. This one is Dr. Simmons Johnson, Georgia Cancer Center. Dr. Johnson is a gynecologist-oncologist at the Georgia Cancer Center, collaborating with communities across Georgia to prevent and treat cancer. Congratulations, Dr. Johnson. And last but not least, Northwest Georgia Regional Cancer Coalition. As a longtime active member of the HPV Cancer-Free Georgia, working through Northwest Georgia Cancer Coalition, Allison Agnew has developed, planned, and successfully completed multiple HPV awareness initiatives over the past several years. Among her 2021 accomplishments was her strong collaboration with work group stakeholders and Georgia Department of Public Health District 11 and 12 to provide HPV patient parent education as part of an adolescent wellness initiative to over 12,000 middle schoolers in Northwest Georgia. This nomination recognizes Allison's passion, dedication, public health advocacy, and her impact on vaccine confidence. Thanks for all you do, Allison, to improve HPV vaccination rates in Georgia. Thank you. Congratulations to all of our award winners. And now, following Dr. Andrew Doyle, personal friend at Wellstar Town Lake Pediatrics, he has joined us today. I pass it on to Dr. Doyle.
All right, Dr. Rodriguez, thank you so much. There I am. Let's see, I got on the screen. Well, again, I'm from Wellstar Town Lake Pediatrics, and I just want to thank everybody for the recognition for our HPV efforts and the vaccination efforts, and just a few words to talk about our experiences with HPV vaccination. As pediatricians, especially our role and our role in this fight against HPV disease really, of course, is providing that protection, making sure that all of our children, our boys and our girls, are protected as best they can be from ever even acquiring the virus or the disease. And of course, the most important way to do that is to get them vaccinated long before they become in contact with the disease, with this virus. But as we all know, unfortunately, there's a lot of barriers that exist out there that prevent children from getting vaccinated. And one of the most important ones out there is just resistance to getting vaccinated, confusion and questions and those issues. And how have we approached that through Town Lake Pediatrics and then also WellStar as a whole, because we're part of a bigger group? And I think the most important thing is that this battle to get our children vaccinated with HPV vaccine occurs long before they hit the age where they are eligible for the vaccine. And it really comes into creating a culture within our practices and within our communities that accepts vaccines as a whole. And HPV, the vaccine, is one of many that we do to provide that best health and protection and preventive health for our children. So by creating that culture where vaccines are seen as a positive and acceptable thing, and we've done that in two ways, I think, through our practice that may be helpful for others that are thinking about this. And one is that we have a policy that we ask all of our patients when they join our practices that they will agree to vaccinate their children according to the recommended vaccine schedules put forth by the CDC and the AAP. And what this does is it allows us to have that conversation about vaccines in general right from the beginning. And then as we go through the lives of our children and it comes time to vaccinate them, it's an acceptable practice. And the patients and the parents know it's coming. They know that we're going to encourage it and they expect us to. And what that then allows us to do is develop this whole team effort between us as the providers and our patients to work towards the acceptance of the vaccines and the delivery of the vaccines and getting that protection in place. So it's not a surprise when finally we hit 9, 10, 11, 12, and it's time to start to consider vaccination for HPV, that opportunity is going to come up. And we find more and more that our patients are becoming more and more receptive to it because we, again, have created this environment where they know that we're looking out for them and they are partnering and we are partnering together to provide these vaccines. And the one other thing that allows us to do is when it does come to that time and now the parents have to make that decision to get their child vaccinated for HPV as early as possible, they still are going to have questions and they're still going to have some hesitancy. And what this allows us to do because of the culture we've created is it provides a safe place within the context of the patient-parent-doctor relationship for them to bring forward their questions and bring forward their concerns, and then we can honestly address them. And there's no more of this hesitancy to even have the discussion. It brings it all out in the open. There are no hidden agendas, and we can present each side, and then it allows us to come together as a care team, patient, parent, provider, all together to provide the best care for the children and give them that prevention. And as we've seen over time, more and more of our patients are now becoming willing to accept the vaccine. We still have a ways to go, as everybody knows, but we're making progress. And we look forward to continuing to get higher and higher rates. So thank you for this recognition. It is definitely a team effort among all of our providers, our nurses, and our parents. And on behalf of all of them, I thank you.
Great. Thank you for that, Dr. Rodriguez and Dr. Doyle. It's great to hear the work that you are doing and all the HPV Champion Award winners are doing across Georgia. It's really true. It does take an entire culture change, and everybody from nurses, to the front desk staff, to everyone in the community to really change the direction and get our HPV vaccination numbers up. So thank you for that, and thank you for those strategies, Dr. Doyle. So
boys, can I
yes.
interrupt for a second? I want to excuse myself and apologize if in my excitement, I think I have missed the practice from Adele, Georgia. I am not sure, but just in case, I want to truly apologize and recognize Southwest Medical, Adele Primary Care, for their high HPV and meningitis coverage numbers, just in case, for the record, memorialize this moment. Thank you.
Perfect. Yes, thank you for that, Dr. Rodriguez. And yes, they've all done wonderful work with vaccinations and advocacy across the board. So we'll move to our next question, which is how many different types of cancers can be prevented by the HPV vaccine? Like last time, please respond once the box prompts you on your smartphone or computer. We'll give this a little bit of time here. Once we get at least half of the participants responding, we'll go ahead and looks like we're plateauing here, so I'll go ahead and we got a few more responses. Go ahead and stop it there and share the results. So yeah, most people got it right. The answer is 6. So 6 different types of cancers that are HPV associated are prevented by this vaccine. So that's cervical cancer, throat or oropharyngeal cancer, anal, vulvar, vaginal, and penile cancers are all associated with the HPV virus. And so yeah, this vaccine is truly cancer prevention. We'll stop that. And so next, it's a pleasure to introduce our next speaker. It is Dr. Ashley Hannings. She received her doctorate of pharmacy from the University of Georgia and is a board-certified ambulatory pharmacist. She currently works in the University of Georgia College of Pharmacy, where she works closely with pharmacy students as the Associate Director of the Introductory Pharmacy Practice Experience. And she also directs the immunization training program for the pharmacist in training. She will be speaking today about the role of pharmacists in the prevention of cervical cancer through HPV vaccination. Thank you so much, Dr. Hannings, for joining us today.
Thank you so much for having me. So a lot of different healthcare providers can play a role in cervical cancer prevention. And my guess is that the pharmacist is probably not the first one that came to mind, and that's okay. But there's been some recent legislative changes that are going to help us play a more active role in the future. And that's what I'd like to talk to you about today. Next slide, please. So our objective for this particular part of the session will be to describe the role of pharmacists in increasing community access to the HPV vaccine. So I know that Dr. Thacker is also going to talk about vaccination and the importance of it. I did want to give a few facts about the vaccine for completeness sake. So the one that we have currently available is Gardasil 9, which covers against 9 different types of the HPV virus. And while there's a lot more types that are out there, the vaccine that we currently have available does provide protection against the types that cause the majority of cervical cancer cases. The vaccine is currently approved as young as the age of 9 and all the way through age 45 through the FDA. As far as when it's recommended for use, it's routinely recommended that everyone, that includes male and female, get the vaccine series around age 11, 12. As was previously mentioned today, that's because we want to make sure that they're vaccinated and have protection before they get exposed. It's available as a 2 and 3 dose series. The 2-dose series is actually approved for children 9 to 14 years old. So this vaccine was originally approved as a 3-dose series. The 2-dose was added as an option a few years ago. And that's because in that particular population, they saw that from an immune response standpoint, there really wasn't a difference between 2 and 3 doses. And so if you can get about a similar effect with fewer doses, that's a huge benefit. And we'll see why in just a moment. If someone doesn't get their vaccine in before that time, you can give the 3-dose series if you're 15 or older, or if you're immunocompromised, you'd want to stick with the 3-dose series. Adults who are age 27 to 45 can get vaccinated. It's not routinely recommended in them just because there's a good chance that they've already been exposed to the virus at that point. But if they haven't been vaccinated, it'd be a good idea for them to talk to a healthcare provider to see if maybe it would benefit them as an individual. Next slide, please. So how are we doing as far as our HPV vaccination rates? So these numbers were taken from 2019 data, and they're for ages 13 to 17. So as you can recall from the previous slide, it's routinely recommended to give this series at age 11, 12. So this population should have already been vaccinated against HPV. If you'll click one more time for me. Thank you. But we're not quite doing as great as we could be. These numbers are definitely suboptimal. So for both males and females, about 70% of this population has received 1 dose. And then if you look at those who are up to date, meaning that they've completed the entire series, those numbers go even lower, and we're around 50-something%, depending on what your gender is. So we really need to work to close this gap here because you do have to get the full series to get the full benefits of the vaccine. For comparison's sake, I wanted to bring up how does this stack up against many of the other vaccines that we give in childhood. So if you look at things like the measles vaccine or the chickenpox vaccine, those rates are usually around 90%, sometimes higher than that. And so we definitely have some work to do in this area because it's definitely lower, and we have some people who aren't completing the whole thing. So as healthcare providers, we really need to think about what we can do to close this gap. Next slide, please. So going back to the pharmacists, so there have been pharmacists who have been giving the HPV vaccine for a number of years, but it's not one that we're really known for. And that's for a few reasons. One of the biggest ones being legal authority. So the pharmacist's authority to administer vaccines vary significantly depending on what state you are in. So your state law will determine the age the patient needs to be to get a vaccine from a pharmacist, which vaccines the pharmacist can give, and also what their level of authority is. So do I need a prescription to vaccinate the patient? Or do I have the authority to make that decision myself if the patient meets a certain criteria and not have to get a prescription? Because that does prevent, create an extra barrier for have to take that extra step to try to obtain that to give someone a vaccine. In the state of Georgia, we're not necessarily known as being the most progressive in this particular area. And up until 2009, we had to have a prescription to administer any vaccine at all. This did change in that year when we got the authority to administer the influenza vaccine without a prescription. And that was largely a result of the 2009 H1N1 pandemic, because there was this great need to get a lot of influenza vaccines out and not enough providers to do so. We made some further progress in 2015 when there was a state law that passed that expanded that authority. So with that law, we were allowed to administer not just flu, but also meningococcal, pneumococcal, and the shingles vaccines under a protocol agreement, meaning that we didn't need to have an individual prescription for the patient. For the flu vaccine, we could do that for ages 13 and up. For those others listed, it was only for adult patients. You will notice that HPV was not one of the ones that was listed there. So what does our authority look like for that one? Next slide, please. So this map is using data from about a year and a half ago, and from summer of 2020, and looks at where the pharmacist authority to administer the HPV vaccine and what that looks like state by state. So you'll see in the state of Georgia, we could give it, but we had to have a prescription for it. And in comparison with the other states, we were much more limited. A lot of them had allowed some other level of authority for the pharmacist to be able to do that without always having to obtain a prescription. We're not the most behind, however, because you'll see that there's a couple of states where the pharmacists are not allowed to give it at all, even if they were to have a prescription for it. Next slide, please. Fortunately, we've seen some recent changes in the last 1 to 2 years as far as the pharmacist's ability to be able to give these vaccines without obtaining a prescription. The first one I'd like to mention is the PrEP Act. So you probably have heard about this before in some context. So this is legislation that came out in response to the COVID-19 pandemic, and it's a federal law that supersedes any state laws. There were several amendments. What I'm about to mention came from, I believe, the Third Amendment. But with that particular one, it allowed pharmacists to order and administer ACIP recommended vaccines to ages 3 through 18, regardless of what your state law is. So ACIP, for those who don't know, that's the advisory committee. It's a group of experts that advises the CDC on vaccine recommendations. So what this means is a pharmacist had the authority to not only administer, but also to make the decision that that patient was a candidate for that vaccine based on the schedule. So it took out the step of having to obtain that prescription. The reason that this is part of the PrEP Act in the first place was because with the pandemic going on, something that was noticed was a lot of routine care was being put off, either due to switches to telehealth or just the need to take care of more immediate needs. And a lot of people weren't able to keep up with their routine vaccines. So what this did was it expanded the options for patients to be able to continue to get vaccinated as recommended. I should mention again, this is federal law, so it currently supersedes state law, but it is in the context of the public health emergency. When the emergency is over, this would no longer be in place and you would fall back on state law. Fortunately, we've had some progress from a state level as well. So in the last legislative session in 2021, there was a bill passed that allowed pharmacists to administer ACIP recommended vaccines to adults 18 and older. And we could go down to 13 for both influenza and any illness resulting in a public health emergency. An example of that would be COVID-19. So essentially now at the state level, a pharmacist can give an adult patient any CDC recommended vaccine without having to obtain a prescription from their provider, which is really huge and a big success as far as access to vaccination. Next slide, please. I know I went through this pretty fast in that we have limited time, so I wanted to bring this all together and kind of explain, what does this mean and what would I like for people to take away? So essentially now pharmacists have an expanded authority to administer the HPV vaccine and have more freedom to do so than we've ever had in the state of Georgia before. So again, our state law says that we can go 18 and up without a prescription. Below that, we'd need a prescription. But currently, as long as we are still under the public health emergency, we don't even need to get a prescription for those who are younger. I hope someday that the state law does decrease because, as we talked about earlier, HPV vaccine, we do want it to get done before the age of 18 because we want it to get done before they get exposed. But this is still a big step forward for us in increasing access to the vaccine. I have a bullet point on here because I know that anytime that a new provider is added to providing a certain service, there's always a concern about continuity and documentation. We do utilize the state immunization registry and are required to document it in that. And so there's going to be, even if it's done by a pharmacist, there will be a record of this vaccine in the central database. And so, knowing this, I would like for patients to think of us as a potential resource for getting vaccinated. And I'd like for other providers to think of us as potential partners for getting these vaccine rates up, especially when it comes to finishing out the series. I know several cases of a patient may have gotten their first dose from a pediatrician and then got a prescription, and the pharmacist making sure that the series was finished. So just a few things to think about in the future. And I think that's about all I've got. You can go to the next slide. If you have any questions, please feel free to contact me. My email is listed on the slide. And thank you so much for having me today.
Thank you for that wonderful talk, Dr. Hannings. And we are certainly thrilled that pharmacists in Georgia are now able to administer a wide range of vaccinations, including the HPV vaccine. And we do hope and look forward to the day when state law could be passed to allow HPV vaccinations from pharmacists at ages under 18 as well. And yes, more partnerships are needed between pharmacists and providers in the community. So that Senate bill that was passed last year, we are thrilled that was also supported by our work group. And just happy that it did pass. And also thank you for all you do in instructing our new pharmacists and pharmacists who are practicing currently on the importance of incorporating vaccinations into their practice. So our next speaker is Dr. Stephen Thacker, who is an expert in pediatric infectious diseases and a professor of pediatrics at Mercer University School of Medicine. He received his medical degree from UNC Chapel Hill and then completed his training in general pediatrics at Vanderbilt University. After that, he completed further training in pediatric infectious diseases at Baylor University in Houston, Texas. He is passionate about HPV vaccination and currently practices in the Memorial Health System in Savannah, Georgia, where he also serves as the Associate Chief Medical Officer. Thank you, Dr. Thacker. We are excited to have you speak to us today.
All right, what an opportunity to be able to be a part of this forum and speak to this group. That's just my introductions, pronouns, he, him. Next slide, please. So the goals of our time together were really to, one, probably touch point on what Dr. Hannings had just presented around HPV vaccination guidance and the current updates, as well as speak to our progress towards our Healthy People 2030 goal. Spent a little bit of time of talking about the impact COVID-19 has had on HPV vaccination uptake. And then, kind of think group-wise really about how we broaden our strategies to increase HPV vaccine advocacy and uptake. Next slide, please. So a little bit of history, right? This journey around HPV vaccination began in 2006, and that's when the CDC and the FDA first recommended HPV vaccination, and it was specifically for adolescent females at the time. Fast forward a few more years, we recognize that it's important to vaccinate males as well as we try to tackle and prevent this disease from ever occurring. And then most recently, you saw the recommendations from Dr. Hannings that we've now included catch-up vaccinations and series starts for up to age 26 and a joint decision-making model for those aged 27 to 45 if they're the right patient base that would benefit from HPV vaccination. Next slide. So the current recommendations, I have these listed out because I think there's key importance here. So the ACIP, or Advisory Council on Immunization Practices, is the CDC's arms, multidisciplinary group that comes up with our recommendations around how to use products, including our vaccines. And so the ACIP's current recommendation is that routine HPV vaccination is to be initiated between the ages of 11 to 12 with a ear note, really, that the vaccination series can start beginning at age 9. Now, I'm a pediatrician and I'm a member of the AAP, the American Academy of Pediatrics. We have a slightly different stance on this. It seems nuanced, but it's very important that we really recommend starting these series beginning at age 9 to 12. And I'll provide some reasoning why later in the talk. The series is a 2-dose series, as mentioned previously, if you start before your 15th birthday, a 3-dose series if you start on your 15th birthday or after. Next slide, please. So I mentioned the Healthy People goal. So, this is our current Healthy People goal 2030 as it's related to HPV vaccine uptake. We had a Healthy People 2020 goal, and it was 80% up-to-date vaccination for adolescent females aged 13 through 15. And unfortunately, we missed the mark on that. So we rolled our goal forward and then rolled in what we know to be important, that males that are adolescents also be up to date for vaccination. And so our current goal is 80%. So keep that number in mind as we move forward in looking at some of our current performance. Next slide, please. So this is a nice trend line on vaccine uptake of some key primary series vaccines for childhood and adolescence, which includes HPV from 2006 to 2020. And I highlighted some of the trend lines around some of the updated recommendations and strategies around HPV vaccination. So the number there with the arrow is our up-to-date rate for all adolescents aged 13 through 17, meaning they've gotten all doses of recommended HPV vaccine. So rolled together, we're nationally at about 58.6%. In females, we do a little bit better at 61%, and then we do in males at 56%. So remember that goal is 80%. So we've still got some runway to get there, and we've seen improvement since the mid-2000s around HPV uptake and adoption, but we still have a lot of ground to make up. Next slide, please. This data was presented just different way for this graphical here, really just pairing us up against how we perform in the state of Georgia relative to the national average. You can see, as unfortunately we do with many health measures in our state, we lag behind the national average. So for females aged 13 to 17, fully up to date for HPV, we're at 58.8%, and for males, we're at 51.2%. So you can see kind of where our opportunity gap is. For those that like to know what your ranking is, Georgia, unfortunately, is 30th amongst the states, tied with Texas and Alaska. And just as for a counterpoint, recognizing that Rhode Island is a very different state with a different population and population size than Georgia, but they're already at the 2030 goal with 83% of their adolescents aged 13 to 17 up to date on vaccination for HPV. Next slide, please. When we think about how we get to where we need to be, we heard a great discussion around disparities of care and some of the key drivers that come. The first step, though, is making sure that you've got visibility to what your state and local community and your practices performance is. This is a roll-up of Georgia data around HPV vaccination and its up-to-date status as we look at it through race and ethnicity. And you see 3 lines there moving over time between 2016 and 2019. And what we see is, unfortunately, continued disparities that fall along race and ethnicity lines. The yellow line above is Hispanic adolescents aged 13 to 17 being fully up to date for HPV vaccination. The purple line is white or Caucasian, and the green line represents Black or African American. And we see that we continue to have disparities and not recognizing that we're not meeting people where they need to be met with the right message. To echo some of the messaging from our excellent prior presenter is part of the challenge here. And I would say for Black and African American adolescents, we're falling behind actually in our performance to where we were in 2018. Next slide, please. Now this slide, I'll try to kind of walk through the narrative. This was a really interesting study that was published last year, but it was looking at data from parents from 2012 to 2018. And the crux of what was being asked here is when we talk to the parents of adolescents who providers recommended HPV vaccine to, but the parents declined, what does that percentage look like? And what we saw over time from 2012 to 2018 is an increasing proportion of unvaccinated adolescents who were recommended the vaccine by the provider, but didn't get it due to parental intent. And there's really 2 ways to look at this. One is it shows that we are recommending it more frequently in practice, whether it be family medicine or pediatrics. And so that's good news. But this also tells another story that we're going to have to understand how to meet and mitigate if we want to get to that 80% goal and get more of our adolescents vaccinated. Because what we're seeing is while the rate of uptake is increasing, the parents that do not have the intent to vaccinate, that gap is widening. We see in parents of boys, it moved from 44 to 59%, for girls, 54 to 68.1%. And so next slide, please. And what are some of the key drivers of that? So that same collection of parents who declined vaccination, what were the reasons that they stated drove this? And so the top 5 from this study included safety concerns. And the reason I highlight this is that between 2015 and 2018, for parents who decline the HPV vaccine for their child, an increasing percentage, now 23%, cited safety. And I highlight this because that's our starting foundation around discussing that, like, because the folks that have adopted and heard the message, they're not our barrier, right? It's the folks that we've not gotten our message to and the space they need to hear it from the right messenger that we need to reach. And in the domain of safety, we're really missing the mark. More people believe that this is unsafe from the parental view. And next slide, when you compare that to the actual reported, so the vaccine adverse event reporting system saw no change in serious health issues after vaccination during the same time frame. The rate there is 0.0018% or less. And during the same time, non-serious health issues reported to the vaccine adverse event reporting system dropped actually from 43 to 28 per 100,000 vaccine doses. Now, I don't say that things reported to VAERS are causal, but they're a trend line of what is the experience. And so we're clearly have a disconnect between the true safety of this vaccine and the messaging that we're using to reach our parents. Next slide, please. I'd mentioned speaking to the impact of COVID-19. I've been a huge COVID-19 vaccine advocate in my community. And, unfortunately, that we have all felt this, that those that live in primary care or are passionate about vaccine advocacy, is that we saw a tremendous decline in well and preventative care visits for children, adolescents, and adults. And this dramatically impacted routine childhood immunizations, especially during the first surge of this pandemic. And I'd argue that this disproportionately impacted HPV vaccination uptake as well. And so the graph you have on the right is key states in the US and the administration of HPV doses to adolescents aged 13 through 17. And this is March 2020 through September 2020 as an example of what a surge of COVID-19 does to a community around access to preventative services, and specifically this case, HPV vaccination. So a huge decline. You can see in some states approaching 100% reduction in HPV vaccines being delivered, and a slow uptake back to normal, and then a rebound where we are doing catch-up immunizations. Next slide, please. While we've seen increasing first doses as we've learned how to manage through COVID-19 over the last few years, we still have not caught up for the lost ground that we had during our earlier surges, and what we continue to have, because with these resurgences, as we're in right now in the state of Georgia, that continue to stall catch up in new HPV vaccination starts. And when we looked at the data in late 2020, even after we lifted all the stay-at-home orders, which you saw part of that spike in that prior graph, we saw that the HPV vaccination rate was still lower than pre-pandemic, from 12% to 28%, depending on the age range that you look at. And so there's going to be consequence to this. And if you just focused in on just one cancer of the 6 that this vaccine prevents, oropharyngeal cancer or throat cancer, there's a potential for an additional 6,000 oropharyngeal cancers in the 21st century due to COVID-19's impact, unless we accelerate our approaches and catch up individuals on vaccination. So this is going to have a significant impact on health outcomes really across the board if we don't get there. Next slide. So how do we get there? I was tasked with speaking to some potential newer strategies, and I'll highlight leaning on our dental partners in our communities as referrers. You heard a great discussion around the role our pharmacy partners and pharmacists in our communities can play around this specific topic. And then I'm going to speak to starting on the 9s, and then close with a really high level overview of the Vaccinate with Confidence framework that the CDC is putting forward. And I would not want us to forget the things that we certainly know worked, which is you've got to have practices committed and educated, because research has shown time and time again that not receiving a recommendation for this vaccine is one of the top reasons that parents will not pursue it for their children. And then, as we saw highlighted earlier in this forum, you have to have engaged HPV champions in every office. And then specifically, we need to equip providers with the tools to be successful in what are sometimes tough discussions. And one of those strategies is around motivational interviewing. Next slide, please. So I mentioned dentists as a potential partner in our communities. When you frame this up and you think about, gosh, almost 86% of children aged 2 to 17 will have been with their dentist in the past year. And in 2020, you add in the fact that the FDA expanded HPV vaccine approval to include the prevention of HPV-related oropharyngeal cancer or throat cancer. And then add into the fact that the rates of oropharyngeal cancer in men is rising at a rate that is far outpacing our HPV vaccination rates in males. We have a great alignment in mission, right? Our dentists are certainly advocates of oral health and oral well-being. And the American Dental Association and the American Academy of Pediatric Dentistry recognize that this is a shared mission amongst primary care providers, public health officials, and our dental colleagues, that they need to be part of the solution to urge dentists, local and state societies to really support the administration of HPV vaccine. And studies have been done where we've surveyed dentists, dental hygienists, and the vast majority have interest and willingness to advocate for HPV vaccination. Some would even be interested in providing it in their office. But the barriers they have are knowledge about their community partners to refer to, and a little bit of knowledge base, which I think is a great opportunity for clinical partners, primary care doctors in the community to connect with their dental partners to create yet another avenue for advocacy. Next slide, please. I mentioned the power of starting at 9. So the idea is that we really can benefit if we start the series earlier. And I'm going to highlight just a few examples for clinic providers that may be of benefit. So when we think about starting at age 9 to 10, this may be preferable if you frame it up into the idea that at 11 and 12, there's going to be several vaccines, maybe 3, maybe 4, now maybe 5, with COVID-19 likely becoming at least an annual vaccine. So there's an opportunity to spread out the vaccine burden by starting earlier. This may be appetizing. And the reason for that is that when you look at which vaccine is left off an indicated series at the ages 11 and 12 for preventative visits, it's almost always the HPV vaccine. And so we really need to start that discussion earlier. Some providers have reported that they initiate this vaccine earlier. It makes it easier to disentangle the HPV recommendation from the sex talk that they usually have beginning at around age 11 or 12. And a retrospective study found that adolescents who start their HPV vaccine series at age 9 or 10 were 22 times more likely to have completed their 2-dose series by age 15 than those who started at age 12. Pretty powerful numbers. Next slide, please. And this is, I really can sum up this slide with probably like 2 points here, just driving home how challenging it is for those of us that take care of adolescents, that they don't show up for preventative care at the rate they should. They're more likely to show up for sick visits. And then after the age of 13, the frequency at which they show up for preventative visits to their pediatrician or family medicine doc drops off very significantly. So all that said, I look at each adolescent visit as potentially the last chance to protect that young adult and adolescent against HPV and future cancer. And it also drives home the point that really we need to look at sick visits differently if practices are not already. You can show up for a sick visit and still 100% safely receive vaccination, specifically HPV vaccine. Next slide. And just to really drive home this point, great example of a simple quality improvement initiative that I think could be conveyed to any practice that has an EMR in their clinic. So this was Nationwide Children's Hospital in their ambulatory pediatric clinic. And what they did was just create an electronic medical record trigger that reminded them to talk about the HPV vaccine starting at the 9-year-old well child check. And what they found was some pretty impressive change in sustainment, in that they went from a rate of less than 5% of children starting their HPV vaccine before age 11 to 35% at 6 months, and then a sustain after 18 months and beyond after the project began of 60%, and it's actually gone higher. Next slide. So, I would argue that any practice could lean on that strategy and be successful. And then lastly, I wanted to close with kind of a more to come. This is really just big picture. So this is the Vaccinate with Confidence framework. And the idea here is that, when we think about the challenges around vaccine adoption, vaccine uptake, we have similar discussions across the board, really. So can we create, using the CDC's resources, and add in new investments, new partnerships, and new activities that really protect communities at risk by understanding where they are, and then also strengthen their trust that these life-saving vaccines are the right choice for themselves and for their children. And the biggest thing I want to highlight in this strategy, because we've used this strategy around the COVID-19 pandemic and COVID-19 vaccination, And I think where we've got the biggest benefit out of this multi-pronged approach is in that stop myths bucket on the top right. The idea that we recognize that we are not in the spaces where people get their information around health decisions and health knowledge, which I would argue is largely social media now. When you look at 40% of consumers find information via social media to inform their health decisions, and 60% of social media users would most likely trust social media postings from clinicians and doctors, that there's a huge gap between myths and disinformation in the social media space, that we have to be more proactive as clinicians, public health leaders, to partner with these social media companies to promote trustworthy vaccine information, as well as engaging our state and local officials to really advance effective local responses to misinformation. So really more to come there. I think all of our learnings in the COVID-19 pandemic will help better inform how we use this framework to impact other vaccine preventable diseases such as HPV. Next slide. And so just to close, my key points, COVID-19 has certainly slowed our progression towards our 2030 healthy people goal of 80% vaccination for adolescents. If you don't already have an HPV champion in your office, identify one today and just start any action plan towards improving uptake. And connect with your community dentist and partner on vaccine advocacy for HPV, because they're ready and they're willing. Start with the 9s and then treat every adolescent encounter like it's your last opportunity to protect them against HPV. And that's it. Thank you.
Thank you so much for that, Dr. Thacker. That was, again, just all the presentations today have been fabulous, and that was excellent too. Just wonderful talk and novel strategies to increase HPV vaccination, both initiation and completion rates, making the most out of every patient encounter, making that strong recommendation for HPV immunization is really just going to be the foundation for Georgia to push forward to get our vaccination rates up. And wow, 22 times more likely to complete the series by age 15 when you get it started at 9. Those are, like I said, very powerful numbers. So thank you again. Next, it is my pleasure to introduce Congresswoman Teri Anulewicz as our next speaker. She has been involved in community and civic service for decades in Georgia and is currently a member of the Georgia House of Representatives, where she has been representing the citizens of District 42 since 2017. Mrs. Anulewicz is no stranger to our Cervical Cancer Awareness Day. She has sponsored this event at the state capitol for many years and has been a strong advocate for women's health initiatives throughout Georgia. She routinely addresses the legislature regarding cervical cancer and women's health, and recently sponsored a resolution in the Georgia House of Representatives to recognize today as Cervical Cancer Awareness Day in 2022. It is my privilege and honor to introduce Representative Teri Anulewicz. Thanks for being here today.
Thank you so much, everyone, for having me here today and for allowing me to once again be a part of this very important and very special day. I'm always happy to talk about the work that the Georgia Cancer Control Consortium is doing, that HPV Cancer Free Georgia is doing, Cancer Pathways, the Northwest Georgia Regional Cancer Coalition, the Susan Jolly Awareness Program, and all of our winners here today. The work that y'all are doing is so important. And we know, because we've been talking about this and hearing from experts and from those on the front lines about how harmful vaccine hesitancy can be. And that's something that I know every clinician is having to deal with and is dealing with in a very thoughtful way, in a way that is very individualized for every patient that they're working with. And I'm, again, just so grateful for the work that everyone here is doing. I am going to be speaking to the General Assembly on Monday morning when we reconvene. We're on the break right now for budget weeks. We've been having appropriation hearings. So appropriately, today was actually when we heard all about healthcare and how we're going to be funding public health in Georgia. But I'm happy to have this information that I'm going to be sharing with my colleagues, and to make sure they know, not just what the impact is of cervical cancer in Georgia, how many people we lose every year, but that it's not just cervical cancer that we're talking about with this HPV awareness, that we are talking about all of these other kinds of cancers, these 6 other kinds of cancers that impact women, men, adults, children, seniors. It's so critical that we share this information. Again, I'm a mother, and I mention this every year. I'm a mother to 2 vaccinated teenagers, and I did not pause once when their doctor said it was time for them to be vaccinated, because I know that I'm vaccinating my children against cancer. And it is a miracle that we are able to vaccinate our children against cancer. And so again, I'm happy to be here today. I'm happy to continue to support the Georgia Cancer Control Consortium and HPV Cancer Free Georgia. And I'm so proud and so impressed by all of the work that all of our champions are doing today. Thank you so much.
Great. Thank you so much, Congresswoman Anulewicz. We know that you're extremely busy, and just your tireless efforts and being a strong supporter of these women health initiatives in Georgia. We just thank you so much. We are also excited that there are some major legislative advances on the national level as well to support our HPV advocacy efforts. And along those lines, we have Elizabeth Brown to discuss HR 1550, the Prevent HPV Cancers Act in the U.S. legislature. She is the legislative director for the sponsor of this bill, U.S. Representative Kathy Castor from Florida's 14th district, which is the Tampa area. Thank you, Ms. Brown, for joining us today and being able to give us an update on this, legislative piece.
Hi, everyone. Thanks, Dr. Boyce, for that introduction. Thank you for having me today. Thank you to Triana for inviting me here to talk to y'all. It's been an amazing morning to see all the great work that y'all are doing in Georgia. And my boss's bill, the Prevent HPV Cancers Act, is going to hopefully build on all the work y'all are doing and give you some resources to continue that work so we can end HPV-related cancers, especially cervical cancer. My boss, she's from Tampa, but I think we all share the same goals of reducing and eliminating HPV cancers and increasing HPV vaccination rates. My boss, about 8 or so years ago, looked at kind of the CDC stats for the Tampa Bay area, for Florida, and our vaccination rates were kind of at the bottom of the bunch. And, you know, she's a mother of 2 daughters, and she was like, well, you know, this is a cancer preventing vaccine. Like, this is revolutionary. We should be promoting it. So we've done a lot of work in the Tampa area. But about 3 years ago, we helped facilitate a discussion on Capitol Hill up here in DC with leading HPV experts, stakeholders, survivors who have had HPV related cancers, to kind of talk about the research that's going on, but what can we do at the federal level to help providers, to help patients, to help survivors, to help stakeholders that are doing the work on the ground. And so we came up with the Prevent HPV Cancers Act. We have a great partner in Congresswoman Kim Schreier from Washington State. She's a pediatrician, so she also understands the importance of vaccinating kids early. So the goal of the Prevent HPV Cancers Act is to create a public awareness campaign run through the CDC to raise awareness about HPV-related cancers and the benefits of the HPV vaccine. So I know y'all are doing amazing work in Georgia, so this will hopefully help give you some of those resources that you need and also help educate parents, providers, and the general public about the vaccine. One very important aspect of this bill, and I know it's been discussed today, is having a culturally competent public awareness campaign so that we're bringing in the voices of folks who have been impacted by these cancers. We're trying to target the populations like rural communities, African-American, Latino communities that have some of these higher HPV cancer rates, and also to try and target boys and men, since we're seeing an increase in the oropharynx cancers related to HPV. So, you know, that's kind of the overview of the bill. We've been very lucky. We actually passed the bill in the House earlier last month. And it's very exciting. We're working on getting a Senate companion to hopefully get this moving and we can get it past the Senate. I know Senate's got some stuff they're doing right now, but have them pass the Senate and then get to the president's desk so we can get this awareness campaign off the ground and really help supplement what y'all are doing at the state level. We're also pushing through the appropriations process to try and increase funding for the breast and cervical cancer program so that we can get into underserved communities and really get those PAP tests going so we can get folks detected early. We're also, I think was mentioned by one of the presenters, we're supporting efforts to modernize state vaccination or immunization registries so that it gives providers a chance to really, keep track of folks' vaccinations. Because I know, one vaccine, if we could get it down to one vaccine would be great. I know getting kids in to get their second vaccine can be difficult. So we want to boost up the state registries and then also do more research at the NIH and really have a focus on HPV related cancers and finding because right now I believe cervical cancer is really the only one with a test. So trying to get more research done so we can test early, get things treated very early. So that's a little bit of the update of what we're doing here in Congress. Reach out to your members of Congress, to your senators once we get things moving on the Senate side. But hopefully this will be a good supplement to what y'all are doing. It's been really, I'm so honored to be a part of this because all the information is so helpful. And we have a prevention for cancer. It's so exciting, and my boss has been very excited to lead the charge up here in Congress and really educate members and staff about this and about how important it is to get kids vaccinated. So thank you so much for having me, and keep up all the great work in the fight to help end HPV cancers. Thanks, everyone.
Great. Thank you so much, Ms. Brown. I know that, again, your schedule is very busy. And so we were thrilled that you were able to join us today and give us that update. It really, is exciting to hear about the things that you're doing in Florida as well. It's just a testament to how we need intervention and help at all levels, local, state, and federal. So thank you for the work that you've been doing. And I'm happy to announce that our next speaker, Ms. Arnold James, has already reached out to our state senators from Georgia, Senators Warnock and Ossoff, and so she is on top of it, as is the work group. So thank you for that. So, like I said, our next speaker is Ms. Triana Arnold James, and she needs no introduction, but she is the creator and force behind the first Cervical Cancer Awareness Day in Georgia 8 years ago with the Susan Jolly Foundation. She continues to tirelessly advocate for cervical cancer awareness throughout the community education process, legislative advocacy, and efforts to improve access to health care for all Georgians. She has done this at all levels as well: international, national, local, and state stages. So as always, Triana, thank you for being here, and we're excited to hear from you.
Unmute. Okay, here I am. I forgot I have to unmute. Thank you so much, Dr. Boyce. And for everybody, that's not a picture of me, that's a picture of Susan. And as I've talked about my story every year, Susan was one of my best friends who gained her wings because of cervical cancer. And like many of us as women, we are busybodies. And oftentimes we put our health on the back burner. We make appointments and we say, we'll get to it. But eventually we never get to it and things get bad. And Susan was a busybody. She did everything for everyone else except, and putting her health on the back burner. And as her having HPV and not knowing exactly what was going on with her, being misdiagnosed, which is another topic that we need to talk about with the, Medicaid expansion here in Georgia. She was eventually diagnosed, but at that time when she was diagnosed, she was at stage 4. And then 5.5 months later, she passed away on January 8th, 2015. And a couple of days later after that, turning my pain into passion, I started the Susan Jolly Awareness Program, which brings the prevention impact of cervical cancer and HPV around the country now. And I appreciate each and every one of you all, but I also want to give a shout out to Representative Stacey Evans, who who started this with me. And one of my great friends and members of Georgia Now, Sharon J. Hill, I just want to give a shout out to them on how we started several years ago, and then to Representative Anulewicz, who took up the mantle along with everyone here and our partners. And I just appreciate everyone. And I always talk about Susan, and you all could go to YouTube and type in Susie Q, the Susie Q story. And I go into details about what happened to her in my journey. But some of the things that I never shared is my journey with having HPV and having precancerous cells. And I say again, just like the other one of our other honorees had talked about, I'm grateful and I have hope. And I'm grateful to my OBGYN because between her, God, and Susan saved my life, because I had precancerous cells in the at the end of where Susan had passed away. And if it hadn't been for our conversations and me educating myself on cervical cancer and HPV, it could have been tragic for me as well, because I'm here again. I'm also a busybody, always putting people on the front burner and putting my health on the back burner. And so that is the reason why I started this, because we as women and men and our mothers and fathers and advocates, we need to make sure that this is one of our number one issues that we advocate for, because it is preventable and it could save lives, as we have seen in all of the talks that we have had today. And I also wanted to share with you all as well as one of the other things that I started was the Pencil Me In Challenge. And that's where I go around the country and I challenge people, especially women that are busybodies, to pencil themselves in. The challenge is you have to put yourself on a calendar. You have to, whether it's take time out for yourself, whether it's going to see your OBGYN or your primary care, you pencil yourself in. The challenge is you cannot cancel it. And we find that is a big challenge, because oftentimes life happens, things happen, and we end up putting ourselves on the back burner and saying, I'll get to it. But this, I want to encourage each and every one of you all that's on this webinar, and those that are listening around the country, to pencil yourself in. Take time out for yourself. When you pencil yourself in, do it in ink. And you cannot cancel it. Make it a point to not cancel your medical, especially your medical appointment, because as the doctor had talked about earlier, our bodies tell us, our bodies talk to us and tell us what's going on. We just have to take the initiative to go find the specialist to do whatever it is that's going on with our bodies to help save our lives. Because I love each and every one of you all, and I want to see you all back next year. So that is what I've done in the past, what I'm doing in the present. So let me talk about a little bit about what I'm doing in the future. What I hope to do and plan to do in the future is continue to travel around the country, but talk to the clinics, especially in rural areas, talk to them about HPV awareness, talk to them about cervical cancer awareness, and maybe even save some lives because of that. And then hopefully my next goal is to make a presentation with the World Health Organization to talk about HPV and cervical cancer. And I'm really excited about doing that. And this journey, I'm just hopeful and appreciative, because what we're doing today and what we do every day is save lives. I'm a child of God. I believe that God doesn't make mistakes, but I also believe that there are things that God has put in place on earth for us to save lives. And maybe had Georgia expanded Medicaid, maybe if we've had these bills, years ago, that Susan's life could have been prolonged. I would have loved to have my best friend who, you saw her, you saw me. However, I do believe that this is a lesson and that is a gift from God. And one thing that she would always say to me, and I can hear her say it now because she was a true Southern belle, is, girl, you're going to make me famous. And you're going to make sure that my name is known around the world. And that's exactly what I'm going to do. Make sure that her name and our foundation is known around the world so that we can continue to save lives. So thank you all, Dr. Boyce and Jana. Thank you all so much, Representative Anulewicz, and all of our HPV champions. Continue to work, continue to spread the word, because not only are you a champion today, but you're a champion for the future. So God bless you and may God keep you.
Thank you.
Oh, you're muted, Dr. Boyce.
Sorry, trying to do two things at once now. Thank you, Triana. What I was saying is that, we could just feel your passion and your energy just through the screen. And we just are so thankful for everything that you have established and just continue to do, and channeling that energy and loss through Susan to making something as wonderful as it is to raise awareness for cervical cancer and HPV vaccination. So thank you. So getting to the end, we did put a link to the survey for people who have to drop off. So please click that if you need to run. But I encourage you to stick around because we have another powerful story from Miss Simona Hall. She's going to join us. She is a cervical cancer survivor and was willing to share her journey with us today. So thank you, Ms. Hall, for being with us.
Thank you so much. Can you all see me? I think I'm having some issues. I still see trainer down here at the bottom.
I think that your camera is off, Simona.
Let me see. Will I turn it back on? No, this. It's saying that we still see Trina at the bottom.
Try that again, Simona. I saw it flash just for a second. Sorry, everybody, for the technical difficulties.
It would be on me.
Go to the Zoom at the bottom left. Zoom screen. Where it says mute and start video. Not on the PowerPoint presentation, but in the Zoom app.
I did.
I'm not sure. Let's see. It's just showing us a blank screen, Simona.
We can see the PowerPoint.
Yeah, you can go ahead, Simona.
Can you hear me?
Yes.
You still can hear me? Okay, well, I wanted y'all to see me, but that's okay. Thank you so much for having me today and allowing me a few minutes of your time to share my story with you guys. I've really enjoyed listening to all the things that are coming together to bring awareness, especially for something that could be prevented if we just work harder and communicate to get the message out to people that are willing to receive the information that we provide. I believe I was age 31 when I finally figured out what was wrong with me. I had in the military lifestyle, you go to so many different doctors. So they told me so many times, oh, you got endometriosis, you got fibroids, you just have a heavy menstrual cycle. And in the process, I started throwing up so much. I had to have surgery on my esophagus and just so many different things that was going on. I was like, this is just not normal to be in this much pain. And by then I'd already had 2 small daughters. And my husband at the time, he was in Iraq. I went from Germany to visit my mom and I passed out. And my mom was like, we're going to go. I'm going to take you somewhere else. She's like, because something has to be wrong. And she took me to Carswell Air Force Base in Fort Worth, Texas. And after that doctor ran his test, he told my mom, he was like, she needs to have emergency surgery now. And we were like, why? He's like, because you got 6 polyps on your cervix right now that are erupting. So they took me back instantly for that surgery. It was all a shock. It was just like a shock, but a sigh of relief at the same time, because I knew something was wrong with me. I just didn't know what. To be exact, the only thing I can do is explain and express the pain and so forth that I was going through. And my follow-up appointment, my 6-week follow-up appointment, 3 of those polyps grew back. And my OBGYN at the time, she told me that, I already had 2 children. She was like, the best option for you at this point now is a radical hysterectomy. She's like, you already have 2 kids. This is the best option. This is the best thing that I think is done for you. I was like, okay. I went that way and kept going. But all the damage had already been done. By the time I was 31, I've already had 7 surgeries. So the damage had already been done from the going back and forth and the misdiagnosis from the other doctors. And in 2016, I found the knot on the middle of my stomach, and it started getting real hard, and I didn't know what it was. So when I went to the doctor, and I thought it was, a hernia or something. And he did a biopsy on it. It wasn't, it was a tumor, but it was benign. Thank God for that. But it was also so big that it attached to my stomach muscle. So when I went in for 1 surgery, I woke up to having 2. I'm like, what are the chances is that for some, just out of the blue, and I laughed about it a little bit, because at this point I'm like, it's no telling what they might tell me next. But I laughed it off, but I was just like, I'm glad that's kind of over with. Now I can focus on the bigger picture, get information so I can help somebody else, because I literally can say that I suffered a lot from miseducate, from not having the right information and not having nobody really listen to you, doctors talking over you, and not really understanding what it is that you're telling them, which I think is very important to use your voice. Your voice is your power. Your voice is your power, and having people to silence you when you're trying to speak about advocating for your health and somebody else's health, that's not your power. Your power is your voice. You have to overspeak them. You have to speak your truth in order to get your point across and to get people to understand what it is that you're going through and how you are and how much you're suffering in the process. So, and also like 2 or 3 months after that, I started a Facebook page. It's called Totally Till. And someone reached out to me on that and asked me had I heard of Survivor, which is a nonprofit organization. I said, no. She's like, I think you should check it out. I think it will be something good for you. Because my Totally Till page on Facebook is just about inspiring and encouraging women to, make sure you following up on your pap smears and wearing teal and white. All cancer for women is not breast. There's more to women than just breast. So it was like very important and always been important for me to share that there is so much more to us women than just being in the kitchen, taking care of everybody else. As Trina said earlier, we spend so much time putting everything on the back burner, and it's time for us as women to stop doing that and taking ourselves and making ourselves a priority. So I wrote a letter, and I went on a 4-day retreat to become a survivor ambassador, which is a nonprofit organization. We show support. We have all types of resources and information it's just like a community just for women to get together, all to share, because everybody's been through the same thing. And I had a bag. I started making little goodie bags that I pass out all the time. I have a cervical calendar, and it's an information sheet on the inside of it, which is giving information and resources for people that can help. And I put like little goodies and keychains and chapsticks, gum, stuff that'll make you interested in teal and white. Oh, that's a teal and white bag. I wonder what's in that bag. I want one of those bags. So I feel like when I give these bags away, I feel like I'm making a point to get people to talk about teal and white, to get people to talk about cervical cancer, because it's so important to me. And I feel like if I make a difference, if I reach one person, I feel like I've already succeeded. So in saying that, I thank you again for allowing me to share my story with you. I really appreciate it. I fudged up something down here where you can't see my cute little bag that I made to show y'all.
That's okay, Simona. We see your beautiful pictures on the screen, sporting the teal ribbon and the teal jacket and glasses, and
yes.
Your story is powerful. Just with the words itself. Although we would have loved to seen the bag too. But
yeah.
We know it's hard to sometimes relive those experiences, and
it really
it can
is.
bring up a lot of emotions. So
it
thank
really
you for.
is.
Yeah, thank you for just being willing to share your experience, and we just really appreciate it.
No, absolutely. Thank you for having me.
All right. So we'll actually skip this question just to honor people's time. And here's our call to action. And so we will move through this kind of quickly as well, but just remember that every single person on this seminar today, all the participants, no matter where you are or what you do, can be an advocate for HPV awareness, cervical cancer awareness. So for healthcare systems and providers, identifying patients who have missed doses of the vaccine and contact them to schedule appointments. Prompt healthcare providers to ask about HPV vaccination status, use every patient visit as an opportunity for vaccination, and just like Dr. Hines said, really understand those social determinants of health that drive inequity in health outcomes, cervical cancer outcomes, HPV vaccination. It just impacts every part of our life. For parents and caregivers, you can check with your healthcare provider to see if their child is up to date on HPV vaccinations. For adults up to age 26, this is where the CDC recommends checking with your healthcare provider to see if you've completed the HPV vaccination and to catch up if you have not. And then also for adults 27 to 45, to discuss with your healthcare provider to determine whether you would benefit from receiving the HPV vaccine as well. So we all have roles, and there's all ways that we can help. So next slide. Let's see. So with that being said, this is how you contact us. If you would like to learn more about our group or how you can help, please contact Andre Vassi. His email address is there on the screen for more information about HPV Cancer-Free GA Work Group. You can also connect to us on social media. Just a huge thank you to all of our speakers, our survivors, especially the Georgia Department of Health, GC3, the HPV work group, all the work that the Policy and Advocacy Subcommittee does to make this program possible. Triana, Representative Teri, thank you so much. As a reminder, please let us know how we did today and fill out the survey. And if you want to get the continuing education credits, be sure to fill out part 2 as well. Thank you all for attending today, and we look forward to seeing you again next year. Thanks.